Hi there, it's Dr. Jennifer Thompson with Balance Chiropractic and Wellness, and today I'd like to share with you some information on a Webster Technique. It is a technique that we use here in the office. I am a certified Webster Technique chiropractor, and so I want to talk about a few things, why it's important, what the technique is, and how it's performed, and when an expecting mom can begin chiropractic care. So the Webster Technique was developed by a chiropractor named Dr. Larry Webster. He is the founder of the International Chiropractic Pediatric Association, and that is the association that administers a certification for Webster Technique. So why do we need to seek out a Webster certified chiropractor? Because it's important that you seek out somebody during your pregnancy that has had extra training in order to deal with the pelvic biomechanics and the ligament changes and the body changes during pregnancy. Webster Technique is a very specific technique that is used in order to evaluate the spine and the pelvis, specifically the sacrum, as well as the anterior structures of the pelvis, your pubic bone, and then all the related ligaments. As your uterus sits inside your pelvis, grows and expands during pregnancy, those ligaments can cause tension. Your spine can become misaligned due to laxity of your ligaments, laxity of the structures of the pelvis because of relax and release, oxytocin release, and all the other hormones during pregnancy. So when a chiropractor is certified in Webster Technique, we are looking for those pelvic biomechanics in order to prevent any imbalances in the pelvis, any stress and strain on the pelvis and the surrounding structures. Because we know that if we have stress and discomfort and tension on the sacrum area here, as well as on the anterior structures, the pubic bone, we know that that can cause tension and torsion on the uterus. And occasionally when that tension and torsion is present, we have something called intrauterine constraint. An intrauterine constraint is responsible for suboptimal fetal positioning. So a lot of women come to a chiropractor during pregnancy to help assist in the fetal positioning because of some of these stress and tensions. But primarily the Webster Technique is utilized to just really make sure that those pelvic structures are balanced, that the biomechanics of the pelvis are intact so that your body can go through the process of carrying a baby to full term as well as going through the labor and delivery process. So how Webster Technique is performed in our office and in most offices that utilize Webster Technique and see pregnancy patients, we use these special pillows. They have a cutout in the center to help cushion the abdomen of the pregnant mom. And then we go ahead and evaluate the sacrum utilizing leg checks, stress checks. We'll do the adjustment to the sacrum, any other areas of the spine that need it. Then mom turns over anterior. We address the structure of the pubic bones as well as the round ligaments. Most pregnant moms know what the round ligaments are because they can cause a lot of tension and a lot of tightness during pregnancy. So one of the biggest questions I get is, when can an expecting mom begin chiropractic care? As soon as you find out you're pregnant, chiropractic care is safe, it's effective, and it's very gentle. And then getting started with chiropractic early on in pregnancy, we're looking at preventing any concerns with those pelvic structures so that we don't run into problems later on in pregnancy with things like sciatic pain, pubic bone pain, symphysis pubis disorder or SPD, as well as any fetal positioning concerns. And so if you have any questions about Webster Technique and about how it can help you or somebody that you know that's expecting, please feel free to give us a call. Our link is below the video as well as in our blog post, and we look forward to talking to you soon. Thanks and have a great day.